Hello. We are live on all platforms. Okay. Hello and welcome to episode 2 of Revealed. What is Revealed, you may ask? All 4 of you. Hi. Revealed is a live stream where you talk about what plastic surgery you've had done, what your motivations were, how your journey went, what you've learned, and if you would do it again. Ultimately, this is a show about educating people about engendering understanding, about why some choose to go under plastic surgery. And also, if you're going to have a journey soon, hopefully giving you some more insight into what that could look like, the good and the bad, and helping you make a more informed decision moving forward. There are 3 ways to be a part of this broadcast. One is that you click into the show and you share your own story and your own journey. 2 is that you leave a good comment. We love a good comment. And when I say good, I do mean good. This is a show that's about encouraging people, about giving grace where it's due. It is not a show about bashing people, places, or things. So again, if you cannot uplift, then shift. And then 3, you can like and subscribe. We like those options too. And tonight's episode, tonight's live stream, will cut a little early because the Knicks and the Celtics are playing in Game 6 and Knicks in 6. Okay? So I'm hoping that one of you is brave enough to share your story. As you maybe know, hopefully know from the last time, no one is above getting the question whether you're a guest or an expert on this show, what have you had done? And so I'm hoping that someone will come on soon. In the meantime, in between time, we can answer some questions about common procedures that people are getting nowadays and people want to learn more about. So one thing that I get a lot of questions about is lipo, right? Lipo, whether it's combined with putting that fat somewhere else, like the buttock or the breasts, or just lipo for its own sake, people really want to know, how does that work? And who is a good candidate for lipo? So the first thing that I would say is that you want to make sure that you're not using lipo as a means for weight loss. It really is an inappropriate measure for weight loss. And so if you're going to get lipo, then really you may have lost a bunch of weight or you never gained it to begin with. But you have a few areas of stubborn fat that you just want to address and get rid of. The other thing that you should know about yourself before walking into a physician's office is, where is my fat stored? So women, we are blessed that usually when we gain weight, that fat gets evenly distributed throughout the body. But even at that, there are some cases where the fat is in a place where we as surgeons can't reach it with lipo. And so when you look in the mirror and look at your body, namely your belly, I want you to look at where your fat is stored. If you have kind of a belly where it's really perfectly round and barrel-like and kind of sits up high, then more than likely it is not fat that we can actually access. It's what we call intraperitoneal fat, which means it's the fat that's actually surrounding your stomach, your intestines, your liver. And so we can't really poke that with a cannula because then we could actually do a lot of damage and put you at risk for a lot of bad things. Okay? If you're fat, however, and you can tell this too. If your fat is underneath the skin, just do a pinch test, right? You can pinch and see how much fat you're able to pinch underneath the skin. Again, if you're pinching like that much, you may be a good candidate for lipo. If you're pinching this much, you may actually be a candidate for what we call HD lipo or high definition lipo. And then if you're pinching a lot more than that, then probably consider the gym and diet first. Okay. Any other questions about that? So I created this live stream because I really wanted to talk to real people and figure out why they chose plastic surgery and kind of what they went through. Because I think as a physician, I see a very different side, right? I don't go home with you at night to know what you are looking at in the mirror when you are home by yourself. I don't see what you see. I don't go through kind of the ups and downs with you at home. I don't have to walk your stairs with you. I don't have to do any of that with you, right? And so when I see you in the office, maybe once a week, maybe once a month, maybe once every 2 weeks, if I ask you how you've been doing and you tell me fine, then I'm gonna have a very different picture of what that fine has meant for you, right? And so I really want to be able to talk to real folks out there and see how y'all doing. What y'all been through? We all know plastic surgery can be really fun. I know I personally have a lot of fun doing it. And I think it may be fun for patients too for the transformation piece of it, but for the journey, it may be one that you didn't anticipate. It may be one that you may never embark on again. Or it may be one that you actually tolerated just fine. And maybe you've done it more than once, more than twice, 3 times a lady. So, whatever it is, I'd love to hear about it. And I'd love to hear what your experience has been. Let's give it some more time because some of y'all are on CP time. And that's okay. But I want to respect your time and make sure that I am here when I say I'm going to be here. For the people who are on the live right now, please leave some comments below. Let me know how you heard about the live, what made you come on. If you were here last time, if you liked what we talked about last time. For those of you who weren't able to join us live or weren't able to see the video on YouTube, it really was a great first show. We had Tani B. I hope I'm pronouncing your name correctly, Tani. She is a content creator, and more than that, but she is known on YouTube, on Instagram, on TikTok, and she was very frank about her journey. She had, if I'm not mistaken, she had 360 lipo. She never did get a BBL. She had her breast done as well. And she had some very good insights. So one is that she agreed and stressed with me how important it is to seek out a board certified plastic surgeon. If you are in another country and American board of plastic surgery isn't, your reality, then there are still ways to make sure that your surgeon is well credentialed. She said that she went to one doctor who hopefully she didn't name, I think she might have named that person, but we don't remember. So that's good. And that person turned out to be a dermatologist. But that person was posting befores and afters of lipo. And to me, it's really wild to me that there are dermatologists, dentists, family practice physicians, OBGYNs that are getting into the game of plastic surgery. I understand the idea and maybe the motivation. Medicine has changed drastically. Insurance has changed drastically in the last few decades. And so plastic surgery is a way to kind of keep your head above water if you're a physician in some cases. But that is one risk that as a physician, I would never make. And so as a patient, a potential patient, I would also never encourage anyone to go to someone who's not a plastic surgeon, who hasn't trained in plastic surgery. So that was one great insight. So she ended up not going with a dermatologist. She found a good surgeon. I think the surgeon is in her current hometown of Atlanta, if I'm not mistaken. And she was able to get 360 lipo. Now, at one point, she had considered getting a BBL as well, but decided that she did not want to do that because she had heard that the BBL can be a little dangerous. And we discussed that, yes, BBLs can be dangerous. Historically, they have been the most dangerous thing that we do in plastic surgery. The safety profile has increased, meaning that it's gotten safer as we've gone along. And that's mainly because we're making sure we're staying in the right plane, right? And so the deaths that we were seeing before from fat embolism or fat getting into the large veins and things of that nature, we're not seeing anymore to the degree that we were before. So that means that you still need to find someone who is board certified, properly credentialed to do your surgery. Because for those that aren't, we don't know what they're doing. We don't know how they be living, right? So you don't want to do that. We also, and the other question that I ask on this show is, so you've now gone through plastic surgery, whatever it was, right? What would your daughter or son, how would you respond to them if they said they wanted to get plastic surgery to change who they are? And I think that's an age-old question, right? Because to be fair, I think, so for instance, this is not Tani. Tani is not this example I'm giving, but I'm just saying that if there are people out there, and I've seen them on Instagram, so I know they exist, but if there are people out there who change their entire face, like, so I'm not naming any names. I'm not doing this, but there's a woman out there who is now on a TV show that I'm not going to name, whose face is so obviously altered that it's distracting. It's distracting. And so I was like, what's your old face look like? Because this is the new face and it looks kind of a mess. And so I did the Google search, I did the TikTok search, and I found her old face. Her old face was really pretty, really pretty. And the new face, I think, so now there's this new trend of like, what is it? Great features, but poor facial harmony, right? Have you seen that on YouTube or TikTok or Instagram? I think anyway, it's a new thing that people are doing where they show you their features and how they look great individually, those features, but then they put the whole face together and it doesn't look good according to them. Meanwhile, you look at them and they look amazing. So anyway, but she has features now in her new face that you would think are great, right? She has nice full lips. She has, nice full cheeks. What else? I think I really don't want to be racist on here, but the Asian eye thing is coming back in style, right? Where there's a little bit of a slant. Um, Racism is bad, but but so that, I mean, these are things that are coming up, right? These are inspired plastic surgery trends. So she did all that, and I think she also got a chin augmentation too. That's what I'm guessing. I really don't want to name her name, but I do want her on the show because I do want to know what she had done so I can confirm my suspicions and also to figure out with her like why. Because it's not subtle. She's a whole new person in the face and the body too. And so when you have changed your entire face and your entire body, because it's the assumption is you were not happy with who you were before, then it begs the question, if your daughter or your son were to then come to you and say, hey, I don't like who I have become, what is your response to them? Do you say, what do you say? Right? Okay, so there are a few of you here, and I want you to comment. Please, please, please comment. Okay. Is it hypocritical for a parent who's had any plastic surgery done to turn to their child and say, no, I'm going to encourage you. You are beautiful. Don't get anything done. Obviously, that child will do what they want to do. But is there any hypocrisy there, or is that just kind of what parents are here for, to encourage their children? Any opinions on that? My people. I think I personally, I do feel like there is some hypocrisy there, right? If that parent were to say that. But I don't know what credibly they could say otherwise. Yeah. So to make it a little bit personal, I hope she doesn't kill me, but my mom has had plastic surgery done. I'm sorry, Mom, I'm not sharing your business unnecessarily. And I've done one of her surgeries. So, and I remember when I turned, I think I turned 21, and she said to me that when I had turned 18, she wanted to gift me with a nose job. Now, I think we as daughters take on some of the insecurities of our mothers, right? And so, but wasn't that wasn't one that I had. I actually like my nose. I think it's cute. It is wide and flat. It's African as fuck, right? But but it's me, and it fits my face. I feel like my facial harmony is fine. Okay. No, but seriously. So, I was insulted. I remain insulted by that gift. But I guess if my mom hadn't encouraged that or hadn't said that, maybe then she'd be a hypocrite. I don't know. I don't know. But I do think that it's really hard to have children and not have self-love. because inevitably, not only is that destructive for self, but also kind of bleeds onto our kids and sets them up for a little bit of self-doubt as well. Fair enough? Yeah. So let's give it a little bit more time, but the pregame is about to start. And so here we go. Thank you. Miss Phoebe Jane said, my mom asked that I not follow her footsteps with her surgeries because it was not enough to make her happy. Yeah, I think that I think that's sad, right? Because okay, another story. I had a patient who had gynecomastia, and when he came in the first time, he said he had been teased at work. He worked at a job where he had to either wear no shirt or a thin shirt so you could see the breast tissue underneath. Stepping back, gynecomastia is male breast tissue, so male who have breast tissue. So he's been teased at work, and he's been very, very unhappy. And he said to me during his pre-op that he hoped that this surgery would mean no more therapy, no more antidepressive meds, no more feeling bad about himself. And for him, I think that may be true to a little bit, right? To a little extent. But I think there are a lot of people who seek cosmetic surgery as an answer to something much deeper. Going back to my mom and mom, I'm sorry. We're gonna have to put this on the list of things that I do that you don't like. But going back to my mom was the second sister, right? The second of four girls. And her sister, her older sister, was gorgeous. And my mom too. I get it from my mama. Like, like not to toot my own horn, but like my mom is gorgeous, really gorgeous. But she didn't have like the classic Nigerian features that I guess my aunt did when they were growing up. And so my mom, as a teenager, told me that she didn't feel like she was as pretty, and that bled through. So she was unhappy with herself, and I may be making some assumptions about that, but it seemed to me like she was unhappy growing up because she was consistently comparing herself to her sister, who was a bombshell. But the problem can be that you fix the one thing and then you're like, but I'm still not happy, right? Okay, so let's fix the brows now, or let's fix the eyelids. Let's inject a little fat. Let's do a facelift. Let's get a little lip filler. So, and then it becomes like where do you stop? And I do see that with some patients. And for those patients, I do think that plastic surgery is addictive because it works the way that addiction works, right? You get a fix and you feel great in the moment when the fix happens. And then, but after a while, that doesn't last and you need a new fix. As I share that, I realized that shopping is much, for me, is much like that. I love to like shop. I love the process. I love the clicking the link to pay. I love the double click to pay for Apple Pay. And then I love the waiting for the package to come. And then it comes and I'm like, okay, that was cool. But Heather, you just spent like how much money on this? Waiting and praying And it's here, and you're like, okay, oh, well, okay. What are we going to get next? So that is my addiction. But I think for some people, not everyone obviously, but for some people, plastic surgery is the way to address some deeper issues that maybe they otherwise wouldn't. Thank you for sharing that, Miss Phoebe Jane, because I hope that your mom does eventually feel happy. And I'm glad. Well, let me ask you if you're willing to talk more. Did you follow her advice? Did you not get surgery? Or, yeah, what happened there? Anyway, pregame, not pregame. Is it pregame? Before the game? Okay, so Miss Phoebe Jane did not get any surgery. Well, good on you. That's great. That's awesome. That's awesome. So yeah, so this is revealed. No one is revealing today, unfortunately. We had a couple people who were gonna come on, but I'm guessing they're not coming on. And if they are, they're super late. And I do want to see the Knicks play tonight. I promised my husband. So we're gonna see them play, child. Okay. But truly tell your friends, tell your family, tell people that you think have had plastic surgery about Revealed. It's a show for you guys. It's a show to educate you guys, show to share stories, share experiences, maybe some cautionary tales in the mix, right? Every third Friday of the month, I will be here, and I hope you will join me. And then some of these Fridays, I do want to have an expert on. So our first expert was Dr. Ene, who's an anesthesiologist, and she talked about anesthesia and plastic surgery. And we may do a couple of those moving forward as well to hear more different sides. But ultimately, this is a show, it's like a FUBU. It's like FUBU, not a FUBU. It's FUBU. For us, for you and by you, right? I am just the facilitator. I'm just here to help develop the story, help you share the story in a safe space, and hopefully share some insight where I can. But ultimately, it's about you, and we're here. So yeah, third Friday of every month, I will be here. Next show will be June 20th. June 20th, 4 p.m. Pacific, 7 p.m. Eastern, 12 a.m. West Africa time. Tell your friends to come on and let's talk about what they've had done. Okay? Thank you so much for the people that came. We didn't have anyone share their story, but we'll have some more people moving forward. Okay? As always, like and subscribe. Love you lots, and bye for now.